Hello, everybody. The book that I chose for this book review is called The Healing of America, A Quest for Better, Cheaper, and Fairer Healthcare, and it was written by T.R. Reid. And the reason I chose this book is because just right away when I saw the name of the book, I myself am interested in the field of health care because I do want to be a physical therapist. And I just wanted to see what I could learn, and I think that it was something that could pertain to me in my life. And I expected to be reading about different healthcare policies around the world and which was the best. And after reading the book, I realized that there was no one best fit for healthcare. And that's because each healthcare system has its advantages and disadvantages. I used to always think that the United States was just the best healthcare system in the world. And I think one thing I could take away from this book is that Americans can have a better understanding that our healthcare system is not perfect and there can be improvements made to it. There's a huge presence of what the author defines as American exceptionalism, and that's when Americans reject foreign healthcare systems. And that's because Americans might have this mindset that our country is stronger, wealthier, more productive, and we don't need to borrow any ideas from the rest of the world, and it's kind of a prideful way of thinking. And I think the author talks about how his approach was by using comparative analysis, and that is when you approach in a problem solving in which an academic study in what other colleges, and it's just basically a way of approaching the problem in a very methodical way. And one story I have that relates to American exceptionalism is I recently made a friend from New Zealand, and he was talking to me, and we were having a conversation about healthcare and different healthcare systems. And he told me about how healthcare was free in New Zealand, and I thought that was very cool just to hear firsthand from somebody that has the experience firsthand in that different healthcare system. And right away, this other person, part of the conversation, just shut down the idea of free healthcare, and she was very against it. And I think this is a good example of right away people just want to believe Americans are superior. And I don't think that, I'm not saying he was right, I'm not saying she was right, but I think it's just people wanting to be superior. And I think maybe some people need to be a little more mindful on how we can improve as Americans and maybe take notes. Just like the author is saying, maybe we would be able to just take advantages and disadvantages, and we can look at models of other healthcare systems in other countries, and we could see what we could use for that to implement in a part of our healthcare system in the United States. The main thesis of this book was we can find cost-effective ways to cover American by borrowing ideas from foreign models of healthcare. So that's kind of like I was saying, the author, he had, the main idea of the book was he had a hurt shoulder, and he wanted to see how his shoulder injury would be handled in different countries. But more so, it was more an excuse to see different healthcare systems in different countries and advantages and disadvantages of each one, and how he could experience that firsthand. And ways that he could use that to implement in our healthcare system in the United States. And he uses comparative analysis, and he first started by stating the main problems and issues with the United States healthcare system. And some of the main issues is the coverage. Many people are uninsured. The cost, it's really expensive, but it's not quite better for how expensive it is. The quality is actually poor for how much we are paying. And an adoption of foreign healthcare policies is often considered socialized medicine. And just like people being so against socialized medicine, and they think, we don't need to be adopting foreign healthcare policies, but there's many instances of that is present within the United States today. And a good example of that would be the Veteran Affairs or Medicaid or Medicare, I'm sorry. And that's a well-liked government-run medicine program in the United States. And there is not a lot of people that are opposed to the VA, Veteran Affairs. Most people that would generally be American exceptionalists are actually very for Veteran Affairs. So I think it just shows that everybody needs to have a little bit more of an open mind. And two other main reasons that healthcare in the United States is just so expensive than other countries, the author talks about, is the way that we manage health insurance. It was only developed country that relies on for-profit health insurance. And what for-profit health insurance is it's whenever health insurance companies are able to make money off of insurance instead of it just being nonprofit. And the problems that you can run into with that is the for-profit health insurances, they want to make profit, so it usually will raise the prices of things because they're wanting to make money. And it has higher administrative costs than any other healthcare payer in the world. And some issues with health coverage in the United States that the author talks about is, like many of us know, not everybody gets health care or health coverage. And there's racial disparities according to health. So what that kind of means is some people, some groups, some demographics, some races, they might be more prone to, let's say, heart disease or hypertension. And when those races are at a disadvantage economically in a country and they're not able to afford that country, they are being deprived of health care. And what the author talks about is he goes into other models of healthcare in other parts of the world, and what we can learn from each model and how these models are prevalent in the United States. So one of the models he talks about is called the Beveridge model. And this is an example when healthcare is provided and financed by the government through tax payment. So this is whenever you'd have no medical bills, and medical treatment would be just like a public service, let's say the post office. And it'd just be something very simple. You would not have to ever pay out of pocket. And the United States is similar to the Beveridge model. As I said before, we have the VA, Pentagar TriStar system, and he talks about the Indian Health Service, and that's whenever doctors are government employees and they're working in those government-owned facilities, and the patients never have to pay out of pocket. And another model that he talks about is called the Bismarck model. And what this is whenever, just like in the United States, it's when healthcare providers and payers are private, and there's tight regulations of medical services and fees. Doctors, hospitals are private. And this is a lot like in America, because for most working people that are under 65, that are not retired, they have to share premiums with their health insurance policies, and that sometimes has to get paid out of pocket. And a problem with people that are just pay out of pocket is another model is the out-of-pocket model, and that's a model that's in a lot of underdeveloped countries, and that's whenever the rich can afford medical care and the poor cannot. And this does happen in the United States, unfortunately, and that is because there's people that are uninsured in America, and they have to pay stuff out of pocket. And that's just is so expensive. They could be the simplest thing. Like, for example, when I hurt my shoulder, luckily I had insurance, and the arm sling was no more than $50, but whenever I looked at the price with somebody that would have to pay out of pocket, it would have been upwards of $500. And that would just be so expensive, especially for those poor demographics of people that are uninsured and they're not able to afford that. They just basically have to tough it out and not receive the medical care that they need. And some solutions that are the author talks about how we would be able to learn from other models, and we'll be able to learn from other countries, some solutions he talks about would be adopting a national healthcare system with universal coverage that is better organized, and covering everybody would most likely decrease the healthcare costs in the United States. So I thought that was very interesting. So that means that if my apologies. That means our healthcare system is so complex that we're actually making we're making it cost more because of the complexity. So just simply by making it less complicated, we'd be already helping a lot of people. And another solution that author talks about is reducing our healthcare costs would reduce the competitive disadvantages faced by American companies because of health insurance coverage they have to provide for their employees. So there's just such a competitive competitive disadvantage in today's society that that is just making it more expensive also. So that's another solution that the author says that we can learn from other models of the United States and how that would help us. And my initial reaction to this book is I was pretty happy with the amount of information and how easy it was to read. I think the author did a good job of giving good examples and that are happening in our world today that made it very applicable and easy to understand. And I don't think there was any subjects I actually disagreed with, because I think the author did a very good job of not just saying this one is the best. He was very good at saying there's advantages and disadvantages of each healthcare model system and what those were. And I think the main takeaways of this book was that because of the author's thesis, how he says we can find cost-effective ways to cover every American by borrowing ideas from foreign models of healthcare. And I think that is the main thing to take away. There is many things we can learn from other countries. We Americans can all do a better job. We can all do a better job of being less biased to other countries and less willing to listen because they are different. And I think this is very relevant to what we've been learning in class, because I think some of these models very reflect some of the core beliefs. When we were talking about values in the beginning of the semester, we talked about Judeo-Christian values. I think that is very similar to the Beveridge model, where healthcare is more looked at as a right and a necessity of everybody, just like it is everybody's responsibility to make sure everybody is getting the proper care they deserve. So I think that this book was very beneficial in helping just illustrate those ideas and those topics for me and showing them how it is prevalent in the healthcare society. And that is all I have for you guys. Thank you. Have a good rest of your spring break.